So next topic is a common chromosomal abnormalities. Okay. So the human chromosome, we have just seen that every normal human cell, except for the sperm and egg cell, has 23 pairs of chromosome. That is total of 46 chromosomes. Sperm and egg cells will have only one each pair of chromosomes for a total of 23. So these are haploid. Sperm cell and egg cells are haploid. Each chromosome contains hundreds to thousands of genes. The sex chromosomes are one of the 23 pairs of chromosomes. Normal people will have two sex chromosomes and each is either X or a Y chromosome. Normal females have two X chromosomes, XX, and normal males will have one X and one Y chromosome. Okay, now coming to the chromosomal abnormalities. So there are two types of categories. One is a structural abnormality, that is deletions or rearrangements, and second is the abnormalities of chromosomal numbers. Okay, abnormalities of chromosomal number generally arise from meiotic non-disjunction, that is a failure of chromosome pairs to separate during the cell division. Okay, so during cell division, the chromosome pair do not separate. That is called as meiotic non-disjunction. Or there may be problem in the anaphase, that is anaphase lag, loss of chromosome during the cell division. Okay, so there can be numerical abnormality or there can be structural chromosomal instability. So first on the left hand side, you have a numerical abnormalities. You have A, B and C figure on the left hand side. So small scale gain, there is a trisomy. You can see the orange color, three chromosome, that is trisomy. Then you have small scale losses. Okay, so in the middle B figure, you see that there is a monosomy, and C there is a large scale gain in which there is an extra set of chromosome, that is polyploidy. Okay, so this is what is the numerical chromosomal instability. While structural chromosomal instability may be in form of deletion, may be in form of amplification. So some part of the gene is lost leading to deletion, some part of chromosome get added, that is amplification. Then inversion, there is a flipping and translocation where there is a uh, uh, what happens in translocation? There is a transfer of genetic material to the non-homologous. So you see that these chromosome in the D on the right hand side, the orange and the blue, these are non-homologous chromosome and there is a sharing of the genetic material. Okay, so common chromosomal disruptions are aneuploidy, where chromosome that is not a multiple of 23. Then you can have polyploidy, chromosomal number that is 3 or 4 times the haploid number of 23. Then there can be deletion, that is loss of part of chromosome. Then translocation, exchange of chromosome parts between the non-homologous chromosomes. So non-homologous chromosomes, there will be exchange of chromosomal parts. Okay, can have balanced translocation where no genetic material is lost and clinically it is asymptomatic. Then you have a typical Robertsonian translocation. Again, here there can be SBA, joining of long arms of two acrocentric chromosome with loss of short arm. So what happens in Robertsonian translocation? The long arms of the two acrocentric chromosomes will join and there will be loss of short arms. In inversion, what happens? Reunion of separated portion. Chromosomal inversion is a structural rearrangement in which segment of chromosome breaks into two places and it is reversed before being reinserted into the chromosome. So in inversion, there is a what happens in inversion is a structural rearrangement in which a segment of chromosome breaks into two places and it is reversed. Okay, before it gets reinserted, there is a reversion or inversion before being inserted. So changes in the chromosome structure, you can have inversion, you can have translocation, you can have deletion, or you can have duplications. So these are the different problems which we can have. Then there can be crossing over occurs and when chromosomes exchange genes, two chromosomes will overlap and some genes cross over and switch places. So these are the genetic abnormalities. So there may be non-disjunction in which chromosome pair fails to separate properly during meiosis, and there can be monosomy where gamete has one less chromosome than it should be, that is 45 chromosome is the result. So Turner syndrome is the example of it, where one sex chromosome is missing. Okay, then you can have trisomy. Gamete has one extra chromosome than what it should have. It will result into 47 chromosomes. That is Down syndrome, where there is an extra 21 chromosome. Okay. So this also you should remember from SBA point of view. In Down syndrome, there is a trisomy 21, that is an extra copy of chromosome 21. In Patau syndrome, it is a trisomy 13, there is an extra copy of chromosome 13. Edwards syndrome, trisomy 18, there is an extra copy of chromosome 18. In Klinefelter syndrome, there is a 47XXY, X extra X chromosome in males. Then in Turner syndrome, it is a monosomy of X. That is why 45X is the composition. Complete or partial absence of one X chromosome in females. Then you can have Fragile X syndrome, where CGG trinucleotide repeat expansion in the FMR1 gene on the X chromosome. Okay. Cystic fibrosis, where which chromosome gets affected in cystic fibrosis is a chromosome number 7. Mutation in the CFTR, that is cystic fibrosis gene, CFTR gene, commonly delta F50 deletion, okay, on chromosome 7. So in cystic fibrosis, chromosome 7 gets affected. In hemophilia, there is a mutation in clotting factor gene, affect that is factor 8 in hemophilia A and factor 9 in hemophilia B, and it is a X-linked recessive disease. In sickle cell disease, mutation in the HBB gene causing substitution of valine for glutamic acid at position 6. Okay, so this is also SBA. What happens in sickle cell disease? It is a mutation in the HBB gene causing substitution of valine for glutamic acid. Okay, so glutamic acid is replaced by the valine at position 6. Okay, so GLU6 val. So glutamic acid is replaced by the valine at position 6 in sickle cell anemia. This is what is the structure. So these are all SBS. Then phenylketonuria. In phenylketonuria, there is a mutation in the phenylalanine hydroxylase gene encoding phenylalanine hydroxylase. Okay, so these are the things which you should remember. What is trisomy and the examples of trisomy, etc. Then we'll go into the details of each. That is Down syndrome, trisomy 21, Patau syndrome, that is trisomy 13, then Edwards syndrome, trisomy 18. Okay, so this is what is the uh, Down syndrome and the phenotypical features. So in Down syndrome, it is a trisomy 21. There is an excess of 21 chromosome. So prenatal testing can be done. Result of chromosomal mutation, 1 in 900 people born with this particular condition. Likelihood of having a child with Down syndrome increases with advancing maternal age. Symptoms will be mental retardation, upward slant to the eyes, small mouth, abnormal ear shape, and decreased muscle tone, and there is no cure. Okay, so again, they will give you the description of various features, and they will ask you to identify the syndrome. Okay, so you should know various syndromes and their particular description, peculiar features. So symptoms: mental retardation, upward slanting of eyes, small mouth, abnormal ear shape, and decreased muscle tone, hypotonia. Okay, so as you see in the picture, there is upwards palpebral features, there is a flat nasal bridge, there is a nuchal fold, there is a clinodactyly. Okay, what happens in clinodactyly? There is a deviation of the little finger towards other finger. Okay, and that generally middle and the terminal phalanx get affected. Then there is a single palmar flexion crease, and there is a hypotonia. So these are the features of Down syndrome. So these are the, again, this figure shows the Down syndrome features. Okay, and different colors are used here. And blue color, there is a 20, almost up to 25% these features will be present. Then up to 50% red is shown in 51 to 75% of cases. Then 76 to 100% cases, these purple features will be present. That is skin disorder, sterility in males, then otitis media, epicanthal folds, slanting palpebral fissures, mental retardation, hypotonia, short and broad hands, clinodactyly, transverse crease, brachydactyly. So these are the features which are present in more than 76 to 100% of patients with Down syndrome. Okay. Then coming to the Patau syndrome, that is trisomy 13. So trisomy 13 is caused by an extra chromosome 13 in some or all of a person's cells. Normally, person has 46 chromosomes, that is 23 pairs, but in Patau syndrome, there will be 47 chromosomes due to full or partial extra chromosome 13. This genetic abnormality disturbs the normal fetal development and also has got cardiac abnormalities associated. It's a very severe condition. Most affected infants die during the first few weeks of life. So physical features will be, everything will be micro. Most of the things will be micro. That is microcephaly, small head size, then cleft lip, cleft palate, small or missing eyes. That is microphthalmia or anophthalmia. So microcephaly, microphthalmia, okay, and micrognathia. There is small underdeveloped jaw. Then there is a polydactyly, extra fingers or toes, low set ears, and scalp defects, cutis aplasia. So these are the features of Patau syndrome. Okay, there is a mnemonic also in Patau syndrome. So this figure also shows various features of Patau syndrome. Again, it has got a broad flat face, slanting eyes, epicanthic eye fold, short nose, short and broad hands. Okay, small and arched palate, big wrinkled tongue, dental abnormalities, congenital heart disease, enlarged colon, big toes, widely spaced toes. This is particular to the Patau syndrome. Big toes, widely spaced. Okay, there'll be growth failure, mental retardation, flat back of head, abnormal ears, many loops of fingertips, palm crease, spatial skin ridge patterns, unilateral bilateral absence of one rib, intestinal blockage, umbilical hernia, abnormal pelvis, diminished muscle tone. So these are the features of trisomy 13. So Patau syndrome, there is a mnemonic called as cramp, that is cleft lip, cleft palate, renal abnormalities, cardiac defects, microcephaly, mental retardation, polydactyly. You can remember microcephaly, microphthalmia, micrognathia, polydactyly, hypotonia. Okay, so these are the features of Patau syndrome. So there are 13 letters in Patau syndrome, so it's a trisomy 13. Okay. Coming to the Edwards syndrome, that is trisomy 18. Characteristics of Edwards syndrome after birth, there is a hypotonia, low set ears, internal organ forming or functioning differently, heart and lungs, issues with cognitive development, intellectual disabilities, which are typically severe, overlapping fingers and or club foot, small physical size, head, mouth, jaw, weak cry, and minimal response to sound. So overlapping of the fingers is very particular about, and rocker bottom foot. Okay, so club foot and overlapping fingers. If you get these particular features, think of trisomy 18. Okay, because most of the features you see trisomy 13 and 18, they are similar, but you need to further differentiate. Okay, so you should know specific. So overlapping
Shraddha,
fingers,
here is
heart
your
lung
reminder.
abnormalities, club foot
Charging.
or rocker bottom foot, then decrease muscle
Prabha,
tone and low
here
set
is your
ears.
reminder.
Edwards syndrome. So
Charging.
children with Edwards syndrome have underdeveloped bodies, have serious and often life-threatening consequences, including congenital heart disease and kidney disease, breathing abnormalities, gastrointestinal tract and abdominal wall issues and birth defects, hernias, scoliosis. Issues relating to the heart affect almost 90% of children diagnosed with Edwards syndrome and are leading cause of premature death among infants who have the condition next to respiratory failure. So the first cause is a respiratory failure and second cause is the heart disease. So these are the common features which are seen in Edwards syndrome. Then coming to the deletion disorder. Okay. In deletion disorder, you have Angelman syndrome and Prader-Willi syndrome. Okay. In Angelman syndrome, it is an inappropriate laughter with convulsions and poor coordination and mental retardation. Okay. In Prader-Willi syndrome, it is extremely floppy, obesity, constantly hungry, and mild mental retardation. Okay. So in Prader-Willi syndrome, there is a mild mental retardation, but hypotonia and obesity, constantly hungry. So these are Prader-Willi syndrome features. Both diseases are due to identical deletion on chromosome 15q and demonstrate imprinting, a phenomena in which the same mutation results in different phenotypes depending upon whether the mutated chromosome was of maternal or paternal origin. Okay, remember, it is a chromosome 15q deletion. Okay, so there is an identical deletion, but which chromosome gets affected, maternal or paternal, and then the phenotypical features will be different. Okay, if the paternal gene gets affected or chromosome gets affected, then Prader-Willi syndrome will be there. If maternal chromosome gets affected, then Angelman syndrome will develop. Okay, so Prader-Willi syndrome develops when the deletion is on the paternally derived chromosome, whereas Angelman syndrome develops when the deletion is on the maternally derived chromosome. Oh, deletion is the same, chromosome is same. Okay, but whether it happens in the paternal or maternal, accordingly, the syndrome is labeled. If it is a paternal, then it is a Prader-Willi syndrome. If it is a maternal, then it is a Angelman syndrome, and the features will also be different. Okay, so this is the Angelman syndrome. A complex genetic disorder primarily affects the nervous system. There is a delayed development, intellectual disability, severe speech impairment, problems with movement and balance. Features of Angelman syndrome vary from person to person. However, children with Angelman syndrome usually experience delays in reaching milestones, severe learning disabilities, significant communication deficits, a loving, happy, and social demeanor, frequent laughter, delayed motor development. There will be jerky movements, stiff-legged walking style, balance and coordination difficulties, hand flapping, hyperactive behavior, intellectual disability. Epilepsy is seen in more than 80% of cases. So these are the typical features. You look at the picture. So there is a sunken nasal bridge, puffiness around the eyes, can still see the epicanthal fold, eyelid. Okay, blue eyes with starry pattern, long upper lip length, so philtrum is large. Okay, and small and widely spaced teeth are small and widely spaced. Ear to ear smile, this is also very typical of Angelman syndrome. You may there may be these, you look for these particular specific words, that is ear to ear smile. Okay, or small and widely spaced teeth, prominent lower lip and small chin, these are the features of Angelman syndrome. Prader-Willi syndrome, mnemonic is H3O, that is hyperphagia, hypotonia, and hypopigmentation, and there is obesity. So Prader-Willi syndrome will be there when the deletion is affecting the paternal chromosome. Here, the deletion is a problem. The chromosome is same, but whether it is a maternal or paternal, that is important. Now coming to the sex chromosomal disorder. Up till now, we have seen autosomal. Now coming to the sex chromosomal disorders, you have a Klinefelter syndrome, Turner syndrome, and Fragile X syndrome. Okay. So Klinefelter syndrome, here there is a chromosomal composition of the 47XXY. It is present in 1 in 1000 male live births, mild learning difficulties, taller than average with long lower limbs, show mild enlargement of the breast, infertile, absence of sperm, and treatment with testosterone. Okay, so these are the features which you see in the figure, that is Klinefelter syndrome 47XXY. Okay, now next is the Turner syndrome. It is a monosomy, that is 45X is the composition, incidence is low, look is normal, but there is a ovarian failure, intelligence normal, short stature, and the treatment is estrogen therapy. Okay, so these are the features of the Turner syndrome. There is a short stature, low hairline, shield-shaped thorax, widely spaced nipple, short metacarpal fore, then small fingernails, brown spots, nevi, characteristic facial features, fold of skin, constipation, constriction of aorta, poor breast development, elbow deformity, rudimentary ovaries, gonadal stick, underdeveloped gonadal structures, and no menstruation. So these are the features of Turner syndrome. The next is a Fragile X syndrome. Most common inherited cause of mental retardation. Incidence is around 1 in 2000 males. High forehead, prominent jaw, autism, gap in X chromosome. The features are prominent and broad forehead, large ears, long face, and strabismus, squint. Okay. So prominent jaw, dental, crowding high arch palate. So these are the features, and there will be murmur because of mitral valve prolapse, hollow chest, hypotonia, joint laxity, scoliosis, macroorchidism. Okay, so these are the features of Fragile X syndrome. Now coming to the single gene disorder, in which you have cystic fibrosis, hemophilia, sickle cell anemia, and phenylketonuria. Okay, coming to the cystic fibrosis, it is an autosomal recessive disorder. Mutation stops production of protein in lung cells and pancreas. There is a thick mucus and bacterial infections in lung. There is a sweat test for the diagnosis. Then most common in Caucasians, around 1 in 3 3,300. Chest percussions and diet supplements and shorten life expectancy. So these are the features of cystic fibrosis. The last one is next one is hemophilia. It's a sex linked failure of blood to clot. It is rare in females. Injections with clotting factors to stop the bleeding episodes. Okay. Next one is a sickle cell anemia. Okay, sickle cell anemia, there is a mutation in blood protein. Sickle shape develops in the RBCs. There is a screening test available. Most common in African Americans, 1 in 375 is the prevalence. Pain is associated with blocked vessels, causes anemia, fatigue, etc. And common where mosquito-borne malaria is present. Okay. Now here the gene affected is HBB gene on chromosome 11. So sickle cell anemia, chromosome 11 gets affected. And type of mutation is a missense mutation, that is a point mutation. So here there can be SBA. Which chromosome gets affected in sickle cell anemia? It is a chromosome 11, HBB gene, and missense mutation. Okay, so remember chromosome number 11, HBB gene, that is beta globin gene, and missense mutation is responsible for sickle cell anemia. Okay, rest of the things will like glutamic acid is replaced by the valine at position 6 of the beta globin chain. So these are the important things in this particular sickle cell anemia. Then next is a phenylketonuria. Here, mutation disrupts function of the enzyme, leads to high phenylalanine levels in the brain, mental retardation, epilepsy. Screening of the newborns by Hill-Prick test, and 1 in 10,000 Caucasian births it is seen, extremely rare in African Americans, look is normal, need low protein diet and smelly formulas. Okay, here chromosome number 12 gets affected. In sickle cell anemia, chromosome number 11 was affected. In phenylketonuria, chromosome 12 is affected, and gene affected is a PAH gene, that is phenylalanine hydroxylase gene. Okay, so again here it is a missense mutation. It's an autosomal recessive pattern, and there is an inability to convert phenylalanine to tyrosine. So these are the things which can be asked as a SBA. So that finishes the abnormalities of the chromosome. Thank you.